Have you ever taken a bite of something you've loved for 30 years and just stopped? Something felt off. The coffee you've had every single morning suddenly tastes weaker or bitter or almost like nothing at all. Your favorite soup doesn't quite hit the way it used to, and you find yourself wondering, quietly, did I do something wrong? Is this just what getting older means? Here's what I want you to know before we go any further. Food really can taste different as we get older, and that's not something you're imagining. But it's also not something you should assume is simply old age and leave it at that. There are several different reasons this can happen. Some of them are completely ordinary and nothing to worry about. Others are worth a conversation with your doctor or dentist. By the end of this video, you'll understand the difference, and you'll have a simple way to think through what might be going on with your own sense of taste. I want to be upfront that everything we cover here is general health education, not a diagnosis of anything happening with you personally. Think of this as the kind of conversation you might have with a knowledgeable friend before deciding whether it's worth bringing up at your next doctor's visit. Let's start with something that surprises a lot of people. What we call taste isn't really just taste. It's a partnership between your tongue and your nose. And your nose does a lot more of the work than most people realize. Your tongue on its own can only pick up a handful of basic sensations: sweet, salty, sour, bitter, and a savory taste called umami, the one you notice in things like broth, mushrooms, or aged cheese. That's really it. Everything else, the richness of a ripe peach, the warmth of cinnamon, the complexity of a good cup of coffee, comes from aroma traveling up through the back of your throat into your nose while you chew and swallow. Scientists call this retronasal smell. It's why when your nose is stuffed up from a cold, food can taste like almost nothing, even though your tongue is working just fine. You can still tell it's salty or sweet, you just can't tell what it actually is anymore. So when someone says food doesn't taste like it used to, the first honest question is this really about taste, or is it about smell? For most people, it turns out to be some combination of both, along with a few other factors we'll walk through. Now, what actually changes with age? It's true that taste sensitivity can decrease somewhat over the years, and the sense of smell often becomes less sharp as well, sometimes gradually enough that you don't notice until a favorite food suddenly seems flat. Saliva production can shift too, and your mouth may feel drier than it used to. None of this means your taste buds are dying off or that your senses are shutting down. That's an old myth. What's really happening is more subtle. A gradual dulling of sensitivity, changes in the cells that line your nose and mouth, and sometimes dental or oral health changes that affect how food feels and tastes in your mouth. For most people, these shifts are gradual and mild. When the change is sudden, dramatic, or one-sided, that's a different story, and we'll get to that. Let's talk about medications for a moment, because this is genuinely important for anyone taking prescriptions regularly. Certain medications, both prescription and over-the-counter, can affect how things taste, how well you smell, or how much saliva your mouth produces. This isn't true of every medication, and it doesn't happen to everyone who takes them. But if you're managing several prescriptions at once, which is common as we get older, the chances of noticing some change go up. I want to be really clear here. If you suspect a medication is affecting your sense of taste, please don't stop taking it or adjust your dose on your own. Bring it up with your doctor or pharmacist. They can tell you whether that medication is a likely cause and whether there are alternatives worth considering. This is a conversation, not a decision to make alone in your kitchen. Dry mouth deserves its own moment too, because saliva plays a bigger role in taste than most people ever think about. Saliva helps dissolve the compounds in food, so your taste receptors can actually detect them. When your mouth is dry, flavors can seem muted or strange. Dry mouth can come from medications, from not drinking enough fluids, from breathing through your mouth rather than your nose, from certain medical conditions, or simply from changes that happen with age. If you're dealing with persistent dry mouth, staying appropriately hydrated can help, as long as that fits with your individual health situation. If you're managing a heart or kidney condition, fluid intake is something to discuss with your own doctor rather than following general advice, since your needs may be different from someone else's. A dentist is also a great resource here, since dry mouth affects oral health in ways that go beyond taste. Speaking of dental health, your teeth, gums, and mouth play a much bigger role in flavor than people expect. Gum disease, dental problems, ill-fitting dentures, oral infections, mouth sores, or simply not keeping up with oral hygiene can all interfere with how food tastes and how enjoyable eating feels. Sometimes correcting a dental issue brings a surprising amount of flavor back into someone's meals. Regular dental checkups matter for a lot more than just your teeth. Then there's the more familiar culprit, nasal congestion and illness. Colds, seasonal allergies, sinus infections, and other conditions that affect your nose can temporarily flatten your sense of taste, sometimes dramatically. The good news is that this kind of change is usually temporary and improves once the underlying illness clears up. That's different from a change that lingers for weeks or months with no clear explanation, which is worth mentioning to a healthcare provider. Smoking is worth a brief mention as well. It's well established that smoking can dull both taste and smell over time. I'm not here to lecture anyone about it, just to note it as one of the factors that can contribute to this whole picture. Now here's a piece of this that doesn't get talked about enough, and it matters a great deal for seniors specifically. When food stops tasting good, people often change their eating habits without even realizing it. Meals become less appealing, so portions shrink. Some people start reaching for the salt shaker or sugar bowl more heavily, just trying to bring some flavor back. Others lean more on convenience foods and processed snacks because at least those have a strong, familiar taste. And for some, interest in eating drops enough that they lose weight without meaning to. This matters because good nutrition becomes even more important as we age, and a string of less appealing meals can quietly chip away at someone's overall health. The good news is, there are better ways to bring flavor back than simply adding more salt or sugar. Fresh herbs, spices, garlic, and onion can add a tremendous amount of character to a dish. A squeeze of citrus or a splash of vinegar, where appropriate for your diet, can brighten flavors in a way that surprises people. Playing with texture and temperature contrasts, a crunchy topping on a soft dish, a cold garnish on a warm meal, can also make food more interesting to eat, even when the taste itself is muted. If you're managing a medical condition that involves dietary restrictions, it's worth talking to your doctor or a registered dietitian about which of these approaches fit your particular needs. I want to pause here and say something clearly, because it matters. A change in how food tastes does not, by itself, tell you that something serious is wrong. It does not mean you have cancer or dementia or diabetes or a neurological condition or a vitamin deficiency or any specific illness. Taste changes have many possible causes, and most of the time the explanation turns out to be something ordinary like a medication, dry mouth, a lingering cold, or a dental issue. The reason to pay attention isn't to jump to a frightening conclusion. It's simply because a persistent, unexplained change deserves a proper look. The same way any change in your body that lasts longer than expected is worth mentioning to your doctor. So when does it make sense to actually talk to a healthcare professional? A few situations stand out. If a change in taste or smell is sudden, significant, and doesn't have an obvious explanation like a cold. If you're losing weight without trying to. If you're having real difficulty eating enough to stay nourished. If dry mouth is persistent and uncomfortable. If you notice mouth sores that don't heal, or ongoing pain, swelling, bleeding, or unusual changes anywhere in your mouth. If swallowing has become difficult, if a big shift in taste started right around the time you began a new medication, or if taste changes are showing up alongside other symptoms that concern you. Any of these is a reasonable, low-pressure reason to bring it up at your next appointment. And I do want to separate out one specific thing, because it's important for safety. If a sudden change in taste or smell happens alongside facial drooping, sudden weakness, confusion, or trouble speaking, that combination needs urgent medical attention right away, not a wait-and-see approach. That's a very different situation from the gradual changes we've been talking about, and it's worth knowing the difference. For everyone else, here's a simple, non-medical way to check in with yourself. Think honestly about a few questions. Do sweet foods taste different than they used to? What about salty foods? Does your coffee or tea taste the way it always has? Do familiar, well-loved meals seem unusually bland lately? Have smells in general seemed weaker to you, not just in food? Does your mouth feel unusually dry, more often than not? And did any of this start around the same time as a new medication or an illness? This isn't a medical test, and it won't diagnose anything. It's simply a way to notice patterns, so that, if you do talk to your doctor, you can describe what's actually been happening with more clarity. Let me share a few examples that might sound familiar. There's a woman, let's call her Margaret, 72 years old, who noticed her morning coffee suddenly tasted flat and slightly metallic. It turned out to coincide with a new blood pressure medication her doctor had started a few months earlier. A quick conversation with her pharmacist confirmed it was a known, if uncommon, side effect, and they found an adjustment that worked better for her. Then there's Robert, 68, who found that everything on his plate seemed bland after starting a new prescription. For him, staying hydrated and using more herbs and spices in his cooking made a noticeable difference, while he and his doctor sorted out the medication question. And there's Eleanor, 80 years old, whose appetite had quietly dropped off over several months because nothing tasted appealing anymore. Her family encouraged her to see her doctor, and it turned out a combination of dry mouth and a dental issue was largely to blame. Once those were addressed, her interest in meals came back. None of these are real medical cases, just illustrations of how differently this can show up for different people, and how often there's a manageable explanation behind it. So what can you actually do with all of this? Keep up with your dental checkups, since oral health affects taste more than people expect. Stay appropriately hydrated for your own health situation. If you smoke, know that it's one of the factors that can dull taste over time. If a change started after a new medication, bring it up with your doctor or pharmacist rather than guessing on your own. Reach for herbs, spices, and other flavor boosters instead of simply piling on salt or sugar. And keep an eye on your weight and your appetite over time, since those are often the clearest signs that something is worth discussing with a professional. If there's one thing I want you to walk away with, it's this. Food tasting different as you get older doesn't automatically mean something is wrong. Many of these changes are a normal part of aging, and many others have simple, treatable causes once you know to look for them. The real goal here isn't to worry about every change. It's to stay curious about the ones that stick around and to make sure that eating never becomes so unappealing that your nutrition suffers because of it. I'd love to hear from you. Has there been a food you've eaten your whole life that suddenly tastes different than it used to? What was it, and did you ever figure out why? Let me know in the comments below. If you found this helpful, I'd really appreciate it if you'd give this video a like and consider subscribing so you don't miss the next one. This channel shares educational health information based on reputable sources and is not a substitute for personalized medical advice. If you're experiencing a persistent or concerning change in your sense of taste or smell, speak with a qualified healthcare professional.